Hello, today, we're going to discuss a common but painful condition that affects millions of people worldwide: kidney stones. If you've ever experienced the excruciating pain associated with kidney stones, you know how important it is to understand this condition and take steps to prevent it. So, let's dive into the world of kidney stones and discover how you can maintain a healthier lifestyle to keep them at bay. Kidney stones are hard, mineral and salt deposits that form in the kidneys. They can range in size from a grain of sand to a golf ball, causing severe pain as they pass through the urinary tract. While their exact causes can vary, certain factors contribute to their formation, including dehydration, a diet high in sodium and oxalate, family history, and certain medical conditions. Signs and symptoms. Identifying the signs and symptoms of kidney stones is crucial for prompt medical attention and timely intervention. By recognizing these indicators, you can take the necessary steps to address the issue and seek proper diagnosis and treatment. Here are some key signs and symptoms to watch out for. 1. Intense pain in the lower back or sides. One of the hallmark symptoms of kidney stones is severe pain, often described as a sharp, stabbing sensation in the lower back or sides. The pain typically originates in the flank region, just below the ribs, and may radiate towards the groin area. The intensity of the pain can vary from person to person, with some experiencing intermittent discomfort and others enduring excruciating agony. 2. Hematuria, blood in the urine. Another common symptom of kidney stones is the presence of blood in the urine, medically known as hematuria. This occurs when the stones irritate or damage the lining of the urinary tract, leading to small amounts of blood being released along with the urine. The urine may appear pink, red, or brownish in color, depending on the concentration of blood. 3. Frequent urination. People with kidney stones often experience increased frequency of urination. The urge to urinate becomes more frequent, and the volume of urine passed may be smaller than usual. This occurs because the presence of stones can irritate the bladder and cause it to contract more frequently, creating the sensation of needing to urinate more often. 4. Cloudy or foul-smelling urine. Kidney stones can also affect the appearance and odor of urine. In some cases, the urine may appear cloudy or murky due to the presence of sediment or mineral deposits. Additionally, the urine may emit a strong, unpleasant odor, which can be attributed to the metabolic waste products and compounds released during the stone formation process. 5. Persistent urge to urinate. Apart from the increased frequency of urination, individuals with kidney stones often experience a persistent urge to urinate. Even after emptying the bladder, they may still feel the need to urinate again shortly afterward. This sensation occurs as a result of the stones causing irritation and inflammation within the urinary tract, leading to a continuous feeling of bladder fullness. It's important to note that the severity and combination of symptoms can vary from person to person, depending on factors such as the size, location, and number of stones present. Some individuals may experience all of the mentioned symptoms, while others may only exhibit a few. Prevention through hydration. Hydration plays a vital role in preventing the formation of kidney stones. When you stay adequately hydrated, you provide your body with the necessary tools to maintain optimal kidney health. Drinking plenty of water throughout the day is particularly beneficial because it helps dilute urine, reducing the concentration of minerals and salts that can contribute to stone formation. Aim to consume at least 8 glasses of water daily, but remember that individual hydration needs may vary depending on factors such as age, weight, activity level, and climate. In hot weather or during intense physical activity, your body loses more fluids through sweat, making it essential to increase your water intake accordingly. By maintaining a consistent fluid intake, you help ensure a sufficient urine output. This is important because a higher urine volume can help flush out potential stone-forming substances, minimizing their chances of crystallizing and sticking together in the kidneys. Diluted urine is less likely to form concentrated deposits, reducing the risk of stone formation. While water is the go-to choice for hydration, other fluids like herbal teas, diluted fruit juices, and infused water can also contribute to your overall fluid intake. However, it's important to limit the consumption of sugary drinks and beverages high in caffeine or alcohol, as they can contribute to dehydration and potentially increase the risk of stone formation. To track your hydration progress, consider using a water bottle with marked measurements to help ensure you're meeting your daily intake goals. Additionally, listening to your body's signals of thirst and drinking water whenever you feel the need can be an effective way to stay properly hydrated. It's worth noting that if you have certain medical conditions such as kidney or heart problems, your healthcare provider may recommend specific guidelines regarding fluid intake. It's important to follow their advice for a personalized approach to maintaining proper hydration and kidney health. A balanced diet. A balanced diet is crucial not only for overall health but also for preventing the formation of kidney stones. When it comes to kidney stone prevention, it's important to be mindful of what you consume and make informed choices about the foods you include in your daily meals. To reduce the risk of kidney stone formation, it's advisable to limit your intake of certain substances, such as sodium, oxalate-rich foods, and animal proteins. Sodium, commonly found in processed and packaged foods, can contribute to an increased risk of stone formation. By reducing your sodium intake, you can help maintain a healthier urinary environment. Oxalate is a compound found naturally in many foods. Foods rich in oxalate, such as spinach, rhubarb, and chocolate, can increase the likelihood of kidney stone formation. While it's not necessary to completely eliminate these foods from your diet, moderation is key. Consider incorporating a variety of other fruits, vegetables, and whole grains that are lower in oxalate content to maintain balance. When it comes to protein, particularly animal proteins, it's beneficial to consume them in moderation. Animal proteins can increase the excretion of calcium, oxalate, and uric acid, which are substances that can contribute to stone formation. Instead of relying solely on animal proteins, try incorporating alternative sources of protein, such as plant-based proteins like legumes, nuts, and seeds. These alternatives provide a rich array of nutrients while reducing the potential risk of stone formation. In addition to being mindful of what to limit in your diet, it's equally important to focus on what you should include. A varied and well-rounded diet that includes a wide range of fruits, vegetables, whole grains, and lean proteins can support kidney health. These foods provide essential nutrients, vitamins, and minerals that are beneficial for overall well-being, including kidney function. Furthermore, including foods rich in citrate can be particularly helpful in inhibiting kidney stone formation. Citrate is a natural inhibitor of stone formation and can be found in citrus fruits such as oranges and lemons. These fruits are not only refreshing but also contribute to the prevention of stone formation due to their high citrate content. Adding a squeeze of lemon to your water or enjoying a refreshing glass of orange juice can be a simple yet effective way to incorporate these beneficial fruits into your diet. The power of physical activity. Regular physical activity plays a pivotal role in maintaining a healthy lifestyle and can have a profound impact on preventing kidney stones. Engaging in exercise not only benefits your overall well-being but also significantly reduces the likelihood of stone formation by promoting proper kidney function and improving overall circulation. When you engage in physical activity, your heart rate increases, leading to improved blood flow throughout your body, including your kidneys. This enhanced circulation helps deliver vital nutrients and oxygen to the kidneys, supporting their optimal function. Adequate blood flow also facilitates the removal of waste products and toxins, ensuring the kidneys operate efficiently and reducing the risk of stone formation. Additionally, regular exercise promotes the dilation of blood vessels, which aids in maintaining healthy blood pressure levels. High blood pressure can strain the kidneys and contribute to the development of kidney stones. By incorporating exercise into your routine, you can help regulate your blood pressure and minimize the burden on your kidneys, further decreasing the chances of stone formation. Furthermore, physical activity stimulates the production of sweat, which assists in flushing out toxins from your body. Sweating helps eliminate waste materials, including excess salts and minerals, which are potential contributors to the formation of kidney stones. By regularly engaging in physical activity and sweating, you actively support the natural detoxification process of your body, reducing the accumulation of substances that could form stones. Exercise also helps with weight management and maintaining a healthy body mass index, BMI. Obesity and overweight conditions are known risk factors for kidney stone formation. By staying active and maintaining a healthy weight, you lower the likelihood of developing stones. It's worth noting that even small reductions in weight can have a significant impact on reducing the risk of stone formation. To reap the benefits for your kidneys and overall well-being, it is recommended to aim for at least 30 minutes of moderate-intensity exercise on most days of the week. Moderate-intensity exercises include activities such as brisk walking, cycling, swimming, or dancing. These activities elevate your heart rate and breathing, but you can still carry on a conversation comfortably. Stress management. Stress is a common aspect of modern life, and its impact on our overall health should not be underestimated. Surprisingly, stress can even affect the health of our kidneys. When we experience chronic stress, our bodies go through a series of physiological responses that can disrupt the delicate balance of various systems, including our kidneys. Chronic stress triggers the release of stress hormones such as cortisol, which, when present in excessive amounts, can lead to imbalances in our body. These imbalances can affect the way our kidneys function and increase the risk of kidney stone formation. The stress-induced hormonal changes can influence the levels of certain substances in our urine, making it more conducive to the formation of crystals, which eventually grow into kidney stones. To counteract the negative effects of stress on kidney health, it is essential to incorporate effective stress management techniques into our daily lives. There are several approaches you can take to alleviate stress and promote kidney health. Meditation. Meditation is a powerful tool for managing stress. By practicing mindfulness meditation, you can cultivate a calm and focused state of mind. Regular meditation sessions can help reduce the release of stress hormones, lower blood pressure, and promote overall relaxation. By creating a sense of inner peace and tranquility, meditation indirectly contributes to kidney health. Yoga. Yoga combines physical postures, breathing exercises, and meditation to promote harmony between the mind and body. The gentle stretching and controlled breathing involved in yoga practice can help release physical tension and reduce stress levels. By incorporating yoga into your routine, you can improve blood circulation, enhance kidney function, and minimize the risk of kidney stone formation. Deep breathing exercises. Deep breathing exercises, such as diaphragmatic breathing or belly breathing, can help activate the body's relaxation response. By consciously slowing down and deepening your breath, you can stimulate the parasympathetic nervous system, which promotes a state of calmness and counteracts the effects of stress. Regular practice of deep breathing exercises can be a simple yet effective strategy for managing stress and supporting kidney health. Engaging in hobbies. Finding joy and fulfillment in activities you enjoy is an excellent way to manage stress and maintain a healthy mind-body balance. Engaging in hobbies that bring you happiness and allow you to unwind can help reduce stress levels. Whether it's painting, gardening, playing a musical instrument, or any other activity that sparks your interest, carving out time for these pursuits provides a valuable outlet for stress relief. Medical intervention. If you find yourself prone to stone formation or experience recurring episodes, it's crucial to consult a healthcare professional for further evaluation and guidance. They possess the expertise to assess your condition and recommend appropriate medical interventions tailored to your specific needs. When you visit a healthcare professional, they will conduct a thorough examination to determine the size, location, and composition of the kidney stones. This evaluation helps them devise an effective treatment plan that addresses your unique situation. Treatment options for kidney stones vary depending on the severity of the condition and the characteristics of the stones. Here are some potential medical interventions that may be recommended. 1. Medications. In certain cases, medications can be prescribed to assist in the management of kidney stones. For instance, if the stones are small and likely to pass on their own, your healthcare professional may prescribe pain relievers to alleviate discomfort and medications to relax the ureters, facilitating the passage of stones. Additionally, specific medications can help dissolve certain types of stones, making them easier to eliminate. 2. Extracorporeal shock wave lithotripsy, ESWL. This non-invasive procedure employs shock waves to break down larger kidney stones into smaller, more manageable fragments. The shock waves are generated externally and directed towards the stones, causing them to fragment without the need for surgical intervention. Once the stones are broken down, they can pass through the urinary tract more easily. 3. Ureteroscopy. Ureteroscopy is a minimally invasive procedure used to treat stones located in the ureters or kidneys. A thin, flexible tube with a camera, ureteroscope, is inserted into the urinary tract to locate and visualize the stones. The healthcare professional can then either remove the stones directly using specialized tools or use laser energy to break them into smaller pieces for subsequent elimination. 4. Percutaneous nephrolithotomy, PCNL. This surgical procedure is typically recommended for larger or more complex kidney stones. It involves creating a small incision in the back to access the kidney directly. A nephroscope is inserted through the incision, allowing the surgeon to visualize and remove the stones or break them down using various techniques, such as ultrasound or laser energy. 5. Open surgery. In rare cases where other interventions are not feasible or effective, open surgery may be considered. This approach involves making a larger incision in the abdomen or side to directly access and remove the kidney stones. Open surgery is generally reserved for complex or unusually large stones that cannot be treated with less invasive methods. It's important to note that the specific treatment option recommended for you will depend on various factors, including the size, location, and composition of the kidney stones, as well as your overall health condition and individual preferences. Your healthcare professional will discuss the benefits, risks, and expected outcomes of each intervention, allowing you to make an informed decision regarding your treatment path. Kidney stones may be a common occurrence, but with the right knowledge and lifestyle adjustments, you can significantly reduce your risk. By staying hydrated, maintaining a balanced diet, engaging in regular exercise, managing stress, and seeking medical advice when needed, you're on the path to keeping these painful stones at bay. Remember, a healthy lifestyle is key to overall well-being, and your kidneys will thank you. That's it for today's video on kidney stones. If you found this information helpful, don't forget to like, subscribe, and share with others who might benefit from these healthy lifestyle tips. Stay tuned to Healthy Lifestyle Tips for more valuable content on improving your well-being. Take care and be kind to your kidneys.